I make you my property. And you're looking good by your tuba.
I'm so happy Grace Sookchand is here with me this morning. She took some time out of her schedule to really spread the message and to get into a most timely conversation. I mean, obviously, lots of focus on the carnival, and as we can see with our own eyes, we can see via the international news what's happening with the weather in the US, with Europe. And there's this particular uptick after the carnival, especially when the diaspora makes their way to the shores. And there's that natural interaction, the coughing, the whining, the up in each other's face, and people really go down in a serious way after carnival. So we want that to not be your reality for 2026 and beyond. We welcome Grace, the manager of the expanded program on immunization, and we're treating here with the influenza vaccine in time for Carnival 2026.
Correct.
Great to see you, Grace. Welcome.
Thank you so much, Jason. It's wonderful to be here. So yes, it's not only the carnival season, but here in Trinidad and Tobago, it's the flu season.
It is flu season. But I know, I've seen, and I'm sure the empiricals show, there is usually, is there usually an uptick? I remember personally kind of going down after Carnival and having to say, oh my gosh, I have to stay home and catch myself.
That's correct. See, our flu season runs from October to May of the following year, but our peak season starts between December month and then peaks around February, March of this year. So we are actually in the peak season for influenza.
I have the storm, as it will. And that is correlated to lots of folks coming in from overseas.
That is correct. We have, as you mentioned, the cold weather in some countries. A lot of people come to the Caribbean to get the warm, to enjoy Carnival here in Trinidad and Tobago. Unfortunately, when they come, they also bring all these viruses with us. So we need to protect ourselves, protect the population, and if we want to enjoy Carnival, the best thing to do is to make sure you protect yourself.
I would imagine to take the vaccine, one will have to be in good stead, in a good condition, because I've also heard you can't really be sick and then you're going to take the vaccine. It wouldn't really make any sense at that point.
Absolutely. What we advise persons, if you are experiencing symptoms, it could be the common cold, not necessarily flu. But if you are experiencing symptoms, you are advised to wait until your symptoms clear, and then you can go and get the vaccine.
What's the major difference really between, I would say, the common cold and the most dreaded flu?
So, very important. A common cold is mild. It comes on gradually. When you get the flu, it hits you like a truck. Sudden, you get severe body pains, you're aching, you feel terrible, you have headaches, you sore throat, you're coughing, you have high fever, chills. So you really feel ill and you cannot get off your bed to come out to work, or even children in cases to go to school, because you feel really sick, and that is sudden. Whereas with common cold, it's mild. You get a sore throat, you might get sneezing, itchy, watery eyes, but you know, it clears up on its own. It's mild.
Yeah, and yeah, I mean, obviously, we have everybody looking on, we could all relate to getting the flu and being down and out. I remember, oh my goodness, it's at a Carnival, Grace, after. I never feel so before, you know. Full up, lie down there, coconut water, sweating, no appetite. It was the worst, and I promised myself never to go through that again. So let me know, where can we get the vaccine? I know you all had a drive initially, and I understand it continues. So where you head to next? So
the Ministry of Health, in collaboration with Regional Health Authority, they ran a lot of outreach sites to offer the vaccines from January 9th, and it has basically, in most areas, come to a close. However, on the North Central Regional Health Authority, we have extra foods in Arima and Endeavour is continuing the flu drive between Thursdays and Saturday, 10 a.m. to 6 p.m. And on the Southwest Regional Health Authority, today actually at San Fernando Teaching Hospital, they're offering the vaccines for anyone who walks in. C3 on the 6th and 7th of February. At Point Fortin Hospital is on the 6th of February. The Cancer Center South is also on the 6th of February. And on the 7th, which is Saturday, you have Coover District Health Facility, Cedars Health Center, Pinal Health Center, and Maruga Health Center, offering the vaccines between the hours of 8 to 4.
I'll be at C3 on Saturday. What time is the vaccine available on Saturday, the 7th at C3?
Between 11 to 4 p.m.
Okay.
Right. In addition to that, all health centers are given the vaccines. Persons can walk in. It takes less than 5 minutes to get a vaccine. You don't need to walk with an immunization card. You just walk in there and you will ask for the vaccines and you'll get it.
One of the most common questions people ask when taking a vaccine are side effects. Any side effects with this particular vaccine?
So with every vaccine, Jason, you get a mild, you might get a little irritation in the arm, the area, you might get a sore throat. That is mild, that is expected. That is like your body priming itself for the real virus. So what you do is you get the vaccine, your body produces antibodies. And obviously if you're having that reaction, it means the vaccine is working. It is expected.
Understood. And it's a one shot?
It is a one shot.
Yeah, quick in and out, just said less than 5 minutes.
Yeah.
This is a most important conversation, and I would imagine even after the carnival, do you plan to continue with the rollout? Because as you would have mentioned, all health centers would be well stocked. But as it pertains to certain these private sector organizations that you're partnered with, the Extra Foods, the C3s, you plan to keep that momentum going, because you would have said it's October to May. I didn't even realize there's actual season for the flu.
There is a season for the flu. So various regional health authorities work, and what they are also doing in addition to this is that they are honoring requests. So you have organizations who will write to the regional health authority and request vaccines for their particular group of workers, communities. Like for instance, we also have the Geriatric Society of Trinidad and Tobago that are setting up venues around the areas and are requesting the vaccines for their members. So this initiative will continue all the way until May. The vaccines are available. Anyone can access the vaccines. However, very important, I'd like to mention that we do have the high-risk groups that we focus on. These are children 5 years and under, the elderly 65 years and over, pregnant women, and even if you're pregnant and you deliver, the vaccines provide protection to your baby for the first 6 months. We also targeting healthcare workers and especially persons with chronic disease conditions. These are persons, if they get the flu virus, are unable to battle it. They may end up severely ill with pneumonia, hospitalization, and in some cases death. We have had cases of persons contracting the influenza virus and dying.
Yeah, it's something that we don't hear of all the time, but that's a stark reality.
Yes.
And I've seen recently where a good friend of mine had to actually go to hospital, got the flu and got some issues with their lung, and it was a real cause for concern, and a young person too,
Yes. See, the influenza virus, it affects your nose, your throat, and your lungs.
So again, just give me the rollout one more time as to, because I already put down, because I know I'll be in C3 on Saturday, so I've definitely, if I don't make it to a health center before then, you said between 11 to 4.
11 to 4, yeah.
Right? Just give me again the full, all the areas.
Again, so Extra Foods, Arima, and Endeavour continues Thursday to Saturday between the hours of 10 a.m. to 6 p.m. At Southwest Regional Health Authority, today at San Fernando Teaching Hospital between the hours of 8 to 4. The 6th and 7th of February, as we mentioned in C3, Point Fortin Health Center is also on the 6th. The Cancer Center of Trinidad and Tobago South is also on the 6th of February this month, yes, and on the 7th, which is Saturday, you have the COVID District Health Facility, Cedros Health Center, Pinal Health Center, and Maruga Health Center offering the vaccines between the hours of 8 to 4, but persons can walk into any of their health centers and access the vaccines.
And you heard the information there in real time. I must ask Ms. Sookchand, is there any other virus floating around at this point in time that requires vaccination outside of the flu virus?
So there are other viruses that circulate throughout. I know the influenza. I know there have been discussion about what is happening in America with the subclade K, and I imagine that's where that question comes from. But we have been closely monitoring the situation in Trinidad and Tobago. Surveillance continue. The Epidemiology Division of Ministry of Health is closely monitoring the circulation of various viruses, and they can report with respect to it. We have not seen find any of that virus here in Trinidad and Tobago to date. It's mostly we find the influenza type B that is circulating, but we are closely monitoring the situation, and therefore we are offering the vaccines to protect persons.
And added to the vaccine, I think that we need to just keep on top of the campaign to just remind everyone to keep doing the right thing. I think we're just going right back to default mode where people coughing in each other's face, coughing in the hand, nobody washing the hand. You know, it's like, oh my goodness, we have seen in real time the impact of that kind of behavior. And I remember there was a point where everybody was, very conscious of it and sanitizing everything. It was spray down, and we're going right back to square one.
And this is something we should have continued. Hand washing. You cannot overwash your hands. So washing your hands, practicing, when you're coughing to a disposable tissue. If you don't have something available, the crook of your arms, so that you don't spread the virus. If you are not able to wash your hands, then, use a hand sanitizer. And please, if you feel you have the virus or you're coming down with something, wear a mask. Protect yourself, protect your loved ones.
And I would imagine too, even for the parents or adults, if you're not feeling well, best you just stay at home.
Stay at home. Don't go out there to work and spread the virus. Don't send your children to school, because one child walks into school with the virus and the entire class, gets infected.
Yeah, Grace, very important work you do. How many people make up the unit? Because I know you're the manager. How big is your staff?
So it's a small unit, basically. We have about 6 persons there, but we work closely with the Regional Health Authority. Our purpose, really, our job is to procure the vaccines and make sure it's available under the Ministry of Health towards all the Regional Health Authority, and we do provide vaccines to some of the persons in the private sector as well.
And we have enough vaccines in stock?
And we have enough vaccines in stock. Adequate vaccines in stock. We are focusing on the high-risk group, but anyone can walk into the health center and request the vaccines.
That's right, Grace. Any closing words as we wrap things up? Any closing remarks?
I just want to tell persons, you may think that the influenza is mild, it's a common cold. It is not. It is severe. It causes really severe symptoms. You feel terrible. I want to advise the population to protect yourself as you go out this Carnival season. People invest a lot into Carnival. They save their money, they spend their money, to book tickets, to go to these events, buy costume. You want to be able to enjoy your Carnival safely. Please go out there. 5 minutes can save you so much if you get the virus and you're stuck at home and you cannot, enjoy the Carnival season.
Yeah, well said, Grace. That's advice in real time for a real circumstance that many would have had to unfortunately endure, including myself. Tell you, Grace, I was, when I tell you, full up. I said, but with me? I felt it was the worst. That was some years ago, and I promised myself to not go through that again. Grace Sookchand, Manager, Expanded Program on Immunization, giving everyone advice and putting us in the direction where we can indeed get the vaccine and give ourselves that layer of protection going into the Carnival season, and more so beyond. It's not just for Carnival, it's beyond. All the best, Grace.
Thank you so much.
Yes, you're most welcome. Let's get ready for the pause. We come back much more before we head to the news update at 7.
When you climb on top, lift it up, then drop. Push it back, wine.